Good afternoon. I'd like to thank you, Abai, and thanking you. Say thanks to everybody that's here that permitted or promote this occasion for this dialogue. And I'd like to say, first of all, that I won't speak here about a model because it's not a matter of a model. I talk about an experience, an historical experience in Brazil. And I try to show you the essential aspects of this experience that could be useful for you to think about the India reality and the way to go ahead in terms of this struggle for a universal health system. First of all, it's necessary to say that we survived in Brazil to all those 3 decades of neoliberal hegemony, defending a universal health system, adopting a universal health system, influencing through this universal health system other social and political interventions in Brazil, including in the shape of the nature of the relationship between economy and social policies in the country. So it's not insignificant to consider that this experience on health sector in Brazil is something that is bigger than health sector itself. So the first aspect that I'd like to share with you is that this debate is not a technical debate. It's not an economical debate. It's a political debate. And the moment we adopt in our political history the concept of universal access to health, based on the human right to health, the big transformation we made in our minds were a political understanding about health as a right. No? And this shift from a kind of service provision to a broader concept of right is something absolutely fundamental to change the quality of the political struggle. So it doesn't mean that the struggle for health is not only to provide the basic health for some people that need more than others, but the struggle for health is to consider the shape of a nation. Huh? When we consider the human rights, what we are talking about is about the concept of nation, the concept of to be part of a nation, no? To belong to a society where everybody is sharing the benefits of this social life and sharing the richness of the country, no? Through a real Republican perspective. So the first point, the beginning of this history in Brazil is a long time before the 22 years of national health system. It began almost 20 years before when the first group of people began to talk about health as human right. A group of academics, together with social activists, together with some labor unions leaders, they established that one of the main goals of our redemocratization process, because at that time we were in a dictatorship in Brazil, one of the main goals would be to introduce in the Brazilian society the understanding of health as a human right. And there is something interesting because when we compare the nature of our histories, when we compare the caste system in India with the slavery process in Brazil, because as you know, Brazil had a slavery society, a slavery-based society, till 1888. So the slavery disappeared in Brazil only 1888. But in fact, slavery is present in our society till today, in a very structured class society, where the social class are very difficult to move towards a common participation in society, a common identity. So when we talk about universal health care system, universal health system, the right to health, we were talking at that time in a different society, in a society where the social classes would establish this differential possibilities to have health and to keep health in a society. And of course, the link between poverty and the health is extremely important. And when we consider that maybe one of the most important aspects of the poverty, the struggle against poverty, is to protect the domestic economies from the obliged expenditures on health. As you know, and there are many studies in India that demonstrate that people here, the families are obliged or to indebt themselves to pay for health care, or stay looking people of their own families dying because they cannot afford economically the care. So this in a society is something that is a factor of destruction of society, destruction of social tissues, and absolutely lack of a collective perspective in terms to belong to a society and to have the basic rights, the fundamental rights preserved. So the moment when we adopted in Brazil this thought about health as a human right, we were building the basic step to go forward. Because all the other steps to conceive the system, to look for how to finance it, to establish the struggle for a new order in the states, a new organization of the state to manage a public health system, all those later steps were conditioned by the first step, that was to adopt the mission to have in the country a universal health system. So this is very important, I mean, to understand in the context of India, because in the moment that you are able to establish this first step in the Indian society, I'm quite sure that the next steps will be well oriented in the sense to look for the consequent answers to keep or to guarantee these rights.